आवाज आ रही है? We are starting with the topic of drug of addiction or drug dependence. Both are synonyms. The WHO modified the drug of addiction as a drug dependence. Physical dependence, mental dependence, and other effects of the drugs to take it after a short time due to addiction, that is called drugs of addiction. We are starting now. Drug of addiction, drugs which when taken result in compulsive use, usually in increasing amount. That is called drug addiction. Drugs which when taken result in compulsive use, usually in increasing amounts. That is the definition of addiction of the drugs. Drug abuse includes use of drugs to affect mind, body without any medical reason. Without any reason, you are taking drugs to affect the mind and physical body without any medical reason. No any medical indication. You are taking some drugs, that is the drug abuse. Using illegal substances, using chemicals normally not used for body, like blue, example, blue sniffing, excessive use of therapeutic drugs, that is all in the abusing of the drugs. Habituation of the drugs. In this condition, there is a desire to continue use the drugs but no compulsion. There is a little or no desire to increase the dosage. There is no indication, medical indication, no desire, no any physical body indications to increase the dosage. That is habituation. No any effects due to the increase in the dosage. That is called, for example, a new one who is taking the first dose of the drug, the effects is so much. Without any indication, if a person take a drug of addiction on the first dose, the effects are so much. But in a habitual person, there is no any effect if you take a small amount of or large amount or moderate amount of increase of the dosage. There is no any harsh effect of the drugs, particular drug on the physical body or mental. So that is called habituation of the drug. Tolerance, resistance of the effects of drugs developed by the body or tissue so that larger doses are required to produce the original effect. That is called the tolerance. Resistance to the effects of drugs developed by the body, tissues, or that large doses are required to produce the original effect. The particular amount is tolerated. If you require to treat or you require as a medical personnel to give a large dose, because person is already tolerated that for a long time he is taking the same particular dose. So he tolerated the particular dose, and if some time symptom arises in the body, you may require a large dose due to the resistance or tolerance. That next is the drug addiction. It is defined as a state of intoxication harmful to a person and to the society. Intoxication harmful of a person and to the society due to the repeated consumption of the drug. Repeated consumption, there is no any medical indications to take the drugs after a particular interval. Craving to continue taking the drug and tendency to increase the dosage is present. Withdrawal symptoms occur on the withdrawal of the drug. If you stop, then withdrawal symptom occurs due to the withdrawal of the drug. That is called, all these are come in the drug addiction. Definition of the drug addiction. Drug habit, it is a condition in which there is a continued use of the drug, but not causing any harm to the person or to the society, like caffeine. Day-to-day life, we are taking caffeine in the tea, in the coffee. The condition in which the continuous use of drug, but not causing any harm to the person, like caffeine. There is a tendency, but not craving to repeatedly take the drug. Psychology. If you not take the tea or coffee after a particular interval, there is no any harmful effect on the body. There is some desire, but there is no any tendency, but not craving to repeatedly take the drugs. Psychological, but not physical dependency is present. There may be psychological effects occur for some time, but no physical sign symptom occurs with not taking of the caffeine. That is called drug habit. Drug dependence, the term is replaced by the WHO of a drug addiction or drug habit. It is replaced by drug dependence. It is synonyms. It is been defined as a state physically or psychologically in which a person has a compulsion to take the drug, either to enjoy the pleasurable effects or to avoid the discomfort or its absence. That is called drug dependence or drug addiction or drug habit. Physical dependence. These are the types of dependence: physical, psychological. The body needs the drug to function properly. Physiologically of the body is altered. Physiology of the body is altered, and cells of the body are dependent on the presence of that particular drug for a normal functioning. That is called physical dependence. The body needs the drug to function properly. Physiology, so it is run with the physiology of the body. That is called physical dependence. On discontinuation, there will be a withdrawal symptom. Physical symptoms arises like the physical bodily pain. It's called physical dependence. Due to discontinuation, there is a physical body pain occurs. That comes in the definition of physical dependence. Psychological dependence means only mind needs the drug to satisfy the emotional or psychological needs. On discontinuation, there will be no physical symptoms. Only psychological symptoms occur. Mood alters, behavioral alteration may be there, but there is no any physical alteration occurs. Common drug of addictions are, as you know, all these are drugs are drug of addiction: alcohol, barbiturates, tranquilizers, narcotic analgesics, opiate analgesics like morphine, heroin, synthetic or natural ones, stimulants like cocaine, amphetamines, marijuana, hashish, LSD. All these are in the list of common drugs of addiction. These are the common. There are classifications of drugs. So many drugs. Medical drugs, tranquilizers, barbiturates, different type of groups. Classification, sub-classification are there. Stimulants first. Cocaine, commonly called coke, snow or white lady. That is called cocaine, commonly sniffed through nose. Alkaloid obtained from leaves of coca tree. Arthroglylum coca, which is grown in Indonesia, South America, and India. It is a colorless crystalline substance having bitter taste. That is called cocaine. It is sniffed. It is synthetic. It is a synthetic cocaine crack. It is called synthetic cocaine, prepared in the laboratories. It is smokable from obtained by the combining cocaine with the baking soda or water, followed by heating and drying. This is called crack, made by the mixing of the baking soda and the cocaine with water, followed by heating and drying the substances. Speedball cocaine is also mixed with the heroin and dampen its harsh effects to dampen the harsh effect of the cocaine mixed with the heroin. This combination is known as speedball and can be very much deadly. Crack house, place where the crack or cocaine is sold and smoked. In the Western world, common terminology is used and understood by the youngsters. Use of cocaine. Synthetic substitutes of cocaine, xylocaine, novocaine are used as local anesthetic to spray and ointment. Xylocaine is commonly heard day-to-day local anesthetic ointment. Cocaine was used formerly in mixture for pain relief, not a pain, for a pain relief of a terminal cancer from tense cocktail, commonly mixed with the other drugs to relieve the severe pain, like opiate analgesics. Cocaine is commonly mixed with the opiate analgesics to make the from tense cocktail to relieve the severe pain, bodily pain, like the cancer pain and bone, deeper pain inside the body. It is also used as an aphrodisiac, sexual excitement as an aphrodisiac. Mode of action of the cocaine is it stimulates the brain cortex first leading to excitement, restlessness, enhanced motor activity. Lower motor centers get stimulated, producing clonic convulsions. Then the medulla is initially stimulated, causing an initial increase in respiratory rate, followed by the depression with resultant respiratory depression. Such stimulant effects of cocaine are attributed to the inhibition of the dopamine reuptake in the neurons. Acute poisoning mode of intake. Cocaine is usually taken by the nasal sniffing insufflations, but it can also be smoked, ingested, or taken intravenously. This is sniffing, a picture of the sniffing of the cocaine. Sign and symptoms. Cocaine first acts as a stimulant, then depress the higher brain centers in the CNS. Stage of early stimulations. There will be dryness of the mouth, increased mental and physical energy, restlessness, and excitement, tachycardia, tachypnea, hypertension. All these increases. There will be nausea and vomiting. Face will be flushed, red, and pupils will be dilated. These are all the signs of the stimulation, CNS stimulation. Pupil dilated. Stage of advanced stimulants, muscle twitching, convulsions, hyperthermia, cocaine fever, hallucinations. Then start the depressions. Paralysis of the muscles, loss of reflexes, coma, death from cardiac and respiratory failure in the very high doses. Sudden death from cardiac and respiratory failure. Fatal dose, the dose which may lead to death, 1 gram in the adult one when ingested. 30 gram is sufficient to cause death when applied on the mucous membrane or the drug is rapidly absorbed through this route. The time required in which fatality occurs, fatal period, 2 hours. Treatment, drug is applied locally. It should be washed and with the warm water or saline. If swallowed, then stomach wash with the potassium permanganate and the tannic acid. These are the weak acids. Tannic acid. Potassium permanganate is also cause as an antidote to the cocaine. Activated charcoal may be given. It grasps the molecules of the cocaine in the stomach, it is not absorbed, and take it out through the gastric lavage. Benzodiazepines or barbiturates for convulsions, haloperidols for psychosis, supportive measures are also necessary for the cocaine poisoning. The death occurs, postmortem findings of asphyxia, same signs of asphyxia you may heard, were taught by the teachers. Signs of asphyxia there. It may be rapidly destroyed, not detected in the viscera after death. If not detected in early hours, it may be destroyed by the body, dead body. So secretions, so it may not be detected easily in the body. Destroyed, not detected in the viscera after death. Chronic poisoning. Cocaine is a drug of addiction. This addiction is known as cocainism or cocainomania. More harmful than the alcohol and morphine. That's why it is placed on number 1. Mode of intake can be sniffed, taken in the pan, IV injections, smoked in the form of crack, mixed with the weak alkali and water, and then syrup, baking soda and water, and then syrup is called crack. Sign and symptom. If sniffed, then perforation of the nasal septum. Common sign is the internasal septum may be perforated. It's common symptom in the chronic addicts. Anorexia, emaciation, muscle loss, loss of appetite, hyperactivity, flight of the ideas. The person may change the topics very readily. Insomnia, loss of sleep, tachycardia, tachypnea. The patient may shoot. Sexual perversions like homosexuality in the males. All these are very common in the Western world. Increased libido. There may be a delusion of prostitutions. Visual and tactile hallucination are present. Very much used in the Western world. The cocaine in the youngsters. Malignant symptoms. There is a feeling as if grains of sand are lying under the skin and or small insects are creeping under the skin. These are called cocaine bugs. Malignant symptoms are cocaine bugs. Insects are creeping under the skin. Treatment. Gradual withdrawal. Psychotherapy. You may gradually withdraw the cocaine. Psychotherapy is needed. A very difficult treatment. In advanced stage, very, very difficult treatment. Its addict can be treated because abstinence from the cocaine does not cause any physical symptoms, but mainly symptoms are psychological. Medical legal aspects. Drug of addiction, also used as anesthetic, also used in anesthesia, but very little amount, and aphrodisiac by the quacks. Body packers, people who smuggle cocaine by intracorporeal route. The capsules are being tapped and ingested, strongly tapped and ingested, then evacuated by the bowel, where it is dropped and wrapped cocaine in plastic bags and swallowed in the inert drug in the body orifices. From the anal orifices, it may be hidden in the anal rectum or may be ingested from mouth. Then after certain hours, it may be defecated through anal canal. So the plastic is chopped out and the cocaine is taken out. That is called body packers. So many black people are held in the airports, Karachi airport, for the smuggling of the heroin, cocaine, and are treated in the JPMC. I saw personally in the uh, drug addiction ward, medical ward 5 JPMC. So many black people from African countries. They smuggle the heroin, cocaine, and drug of addiction from the Afghanistan, from Peshawar, from Pakistan, the Karachi airport, and the capsules are then recovered by operating. Sometimes they are stuck in the GI, and the GI totally blocked and operated. Otherwise, it may be defecated or from vomit is the capsule taken out from the mouth. So I also saw the personal when I was in the SMC. So this is all about drug of addiction. I given the one example of cocaine and heroin and other drugs of addiction. Opiate analgesics are a separate topic, but here you are taught the cocaine and other drugs. Name of barbiturates are a separate topic in the CNS. So cocaine in this topic is a strong drug of addiction. Its sign symptom, its availability, its drug addiction sign symptom, its treatment, postmortem appearances, and how it is used as a drug of addiction. So this is all about our drugs of addiction, drug dependence, and the cocaine. Thank you very much. Thank you.